Hello friends, there are many scientific evidence that during pandemic throughout more than 1 year the use of substance suddenly raised, whether it is intoxication, occasional or continuous use. All pattern of use of substance is dangerous. Occasional use of substance can also cause extreme harm by intoxication. Continuous use not only has an adverse impact on the user, but it also lead to the problem for the family and society. When I am telling substance, means I am telling not only about the alcohol, but tobacco, cannabis, sleeping pills, opioid, inhalant, stimulant like cocaine, amphetamine and its a derivative, and hallucinogens. Recently, during pandemic, the withdrawal cases of the alcohol raised, and the use of substances of different kind, especially sleeping pills, illicit use of the sleeping pills and other drugs raised. So it is our duty to save the young generation, mainly the young peoples and others, from the substance use disorders. Today, here in this video, we'll learn about how motivation enhancement therapy is used to change the level of motivation to quit any use of substance, whether it is alcohol or cannabis or tobacco or sedatives, sleeping pills like benzodiazepine, clozapine, diazepam, mirtazapine or lorazepam, opioid like opium, pentazocine, morphine, pethidine, etc., or tramadol, very common, codeine. So otherwise inhalant, paint, glue, petrol, stimulant like cocaine, amphetamine. So let's come to understand the different level of motivation and how we can classify in which stage the person is belong to, and how we can help them by the help of motivation enhancement therapy along with the normal treatment, medical treatment. So this fall under the section of socioculture and psychological management of the substance use disorder. Hello friends, today we are going to learn about the motivation enhancement therapy and how to be applied and what are the stages of motivation. And these stages are: number 1, pre-contemplation stage, contemplation stage, preparation stage, action stage, maintenance stage and relapse stage. Let us discuss about the different stages and how we can shift the patient from one stage to another. Hello friends, I am Dr. Santosh Kumar Pandit, head of the Department of Psychiatry, and today we will learn few things about the management of substance use disorder. Substance might be alcohol, cannabis, sedative, inhalant, cocaine. In any substance, the main modalities of treatment is sociocultural and psychological therapy. And one of the psychological therapy is motivation enhancement therapy. It is an approach to help the patient towards considering the change from himself or herself rather than just solely because of the pressure from the others. That general case it's happened because of the pressure of the family or peer pressure. The people went to take the help of psychiatrist. But the motivation enhancement therapy is a special therapy and it's considering the change from the patient part himself or herself. Actually, it depends in which stage the patient is. Stage of motivation finding is most important task before application of motivation enhancement therapy. The stage could be pre-contemplation stage, contemplation stage, preparation, action, maintenance or relapse stage. So in which stage the patient you are finding, the further therapy depends on that. Pre-contemplation stage is such a stage where patient is unaware about his own problem. So when he become aware about the things that his use of substance is a problem for him or might be the problem in future for him, in that case when he acknowledges, then it gets shifted to the contemplation stage of the motivation. And once the thing is acknowledged by the sufferer or the victim, then the change in behavior is required. So once the intention or habit is being changed by the person, then it's shifted to contemplation to preparation stage. And now he acknowledges completely the problem and willing to consider the cost benefit of the change and encourage change and discuss the advantage of the change in this stage. So this is the stage where you can discuss the advantage of the therapy and you can encourage. After that, once there is a tendency or behavior or habit is changed, then the stage of preparation arises. In this stage, already the intention is changed, habit is changed, the person is now prepared to accept the therapy. This stage is known as preparation stage, where the people makes decision to quit the substance, whether it is alcohol, cannabis, cigarette, smoking or whatever, sedative, and the dose something about it. Now once it is confirmed and they started to practice the changed habit, then the stage is action stage. And if the action stage sustained for a long time, then that means the maintenance stage is going on. But within the maintenance stage, it is very important to maintain and sustain the changed behavior. Otherwise, anytime relapse may happen. So, if the relapse happen, in that case, relapse need to be prevented by application of relapse prevention therapy. Otherwise, again patient drop down to the pre-contemplation stage. So, these are the stages of motivation enhancement therapy. And once again, I will just give a gist. Stages are pre-contemplation, number 1, contemplation, number 2, preparation, number 3, number 4, action, number 5, maintenance, and if maintenance fail, again there is a relapse, and from relapse, again maybe slip down to the pre-contemplation stage. So friends, before application of any medical management and after application of a screening tool, must apply the motivation enhancement therapy and must find out the patient or the victim is in which stage of motivation. That will be helpful for further treatment. Thank you.